Today is World Health Day 2025. It is a day actually set aside every single year on April 7th, 2025 to highlight some of the challenges a lot of humans actually go through in the world. And this is another 7th of April 2025 to extray some of these things. Welcome on board. It's Healthy Living right here on Independent Television, and I am Nwoluwapo Stevens. So now this year's World Health Day, celebrated on the 7th of April 2025, will kick off a year-long campaign on maternal and newborn health. Now, with the theme actually titled Healthy Beginnings, Hopeful Future, we'll urge government and health community to wrap up efforts to end preventable maternal and newborn death, and also to prioritize women's longer-term health and well-being. Well, joining me in the studio right now to take a look at this and a whole lot more this afternoon is Dr. Oreoluwa Joshua, and he's right here with me in the studio. Dr. Oreoluwa Joshua is the Assistant Secretary General, Association of Resident Doctors under Edo State Government Employment. Good to have you on board.
Good afternoon.
Thank you. Good afternoon. So let's
Yeah.
quickly scratch it a little bit, the surface. Now, today is World Health Day 2025. How significant is this day?
Yeah, it's very, very significant a day because there are a number of health topics that is treated every year on the 7th of April. So for the year 2025, we're talking about healthy beginning, hope for a better future, and we're focusing on maternal health and newborn health, which is a very big challenge, especially in sub-Saharan Africa, which Nigeria is part of. From research, we have seen that about 70 to 75% of maternal-related deaths occur in sub-Saharan Africa. That's globally.
Wow.
So all of the deaths relating to women, pregnant women, many of them, more than 70% of them is happening in sub-Saharan Africa. And I think that's a call for concern. So the WHO, the World Health Organization, is calling upon everyone, governments, community leaders, healthcare practitioners to be interested in reducing, maternal mortality and even newborn deaths.
Now, let's bring it down home to Nigeria. What do you think the government can do to help salvage some of the situation?
Well, the government is doing some things, and
are they really doing some things, though?
Yeah. For example, I know something like the National Health Insurance Scheme.
Okay.
Yeah, because in Nigeria here, in fact, globally, healthcare is expensive. All right, so there's the insurance scheme which the government has put forth. In Nigeria, there's National Health Insurance Scheme.
Right.
Then some states also have their own insurance schemes, like the Edo is in Edo State.
HIS?
Yes.
Right.
So they try to cater for some or a greater part of the financial healthcare burden that people have. So when you come to the hospital, you're expected to pay a percentage and not all because of the insurance scheme. That's one. Then healthcare workers in some localities also do awareness. So I think what the government can do in addition to that is from time to time, they can organize campaigns, not just on the streets, but where we have people concentrated in maybe in the marketplace, public places, public buildings, institutions. Let people be aware, because I know that the presence of knowledge is a very strong factor in helping people to solve problems. So those who know are better able to solve their problems than those who don't know.
Absolutely. Yeah. And speaking about health challenges and all, brings us to our conversation for today. I feel like one of the things affecting men lately is prostate cancer, and it's one of those common cancers affecting men worldwide. Now, despite its commonness, if I'm to put it that way, there are still many stigmas and misconceptions surrounding this disease that really needs to be looked into. Now, statistics actually have it that around 50 out of every 100 men, around 50% will survive their cancer for 5 years or more after they are diagnosed. Now, let's talk about prostate cancer. It's one conversation I always look forward to because I tend to hear different sides of the story regarding it. But before we even go to some of the misconceptions we hear out there, what is prostate cancer?
Great. So let me begin by explaining the anatomy of the prostate.
Okay.
So that we'll have a better understanding of what prostate cancer is. Now, the prostate is an organ, a very small organ about the shape of an almond fruit, if we know what almond fruit, or this
Can we use egg right now?
Yeah,
egg
about
is quite big.
Yeah, egg is quite big, but smaller than that, right? So, and it's located just before or between the bladder. Bladder is where urine is temporarily stored before it is voided, and the urethra, that is the place where urine passes through before it's voided out of the body. So it's located, it's in men. Okay, it's very important to mention that the organ is found only in men.
Right.
Please. Then it's located just behind the penis in men, and between the bladder. I hope we have an understanding of it. Now, when the organ begins to grow out of proportion, just like other cancers, we can now say there is prostate cancer. Okay, so that's what prostate cancer means. So it's just marrying what prostate is with what cancer is. Cancer is the inappropriate growth of an organ or any part of the body beyond its normal size and spreads to other parts of the body.
So from what I can deduce from what you said, it's in men, every man. So the problem is when it begins to grow abnormally. Now, what actually will cause it to grow abnormally?
Okay, well, like other cancers, we can't really lay hold on a particular cause of cancers, but there are risk factors. That is something that we can associate with the reason this organ, the prostate in this context, is growing. For example, smoking, drinking, obesity, then a family history. If there is a family history.
Did you say smoking?
Yes.
Oh,
in fact, smoking is one of the risk factors for many cancers, including prostate cancers. Then if there's a family history of prostate cancer, maybe an individual, his dad or an uncle or an elder brother has prostate cancer, then that individual has to be careful or has to pay attention to prostate cancer. So these are the common risk factors. So there is no particular thing that we can lay hold upon to say, this is because this person did this thing. That is why he has prostate cancer. So it just like other cancers, it just happens.
Right.
Yeah.
So because we're talking about misconception and stigmas, I was actually yearning for you to say it's because of a lack of a certain activity that is not done, in the health, but then you didn't say that. Because that is one of the major misconceptions. I heard a popular doctor say that as a man, you ought to have sex 21 times every month so as to protect that particular stuff and prevent you from having prostate cancer. And then I heard another woman doctor actually did say that excessive use of it is even a problem. Now the question is, which one is actually correct? And do you think that's like a major factor in prostate cancer?
Okay, first I'll start by saying it's not a major factor.
Okay.
Now, here's the thing. Studies are ongoing, and from the studies that are ongoing, it has been discovered that people who engage in sexual activities frequently have a lower risk of developing prostate cancer. Okay. So from the studies that are ongoing, and some of these studies, if you check online, they'll tell you they are just maybe theories, and studies are still ongoing on that particular misconception. So it's people who engage in sexual activities up to 21 times in a month have been found, that's so far, to have a lower risk for
Has it
developing.
been proven to be true? The
Not
21 times. I mean, could it be more or maybe less? Because how is it really, I'm trying to wrap my head around it, how's it achievable for someone to, I mean, someone who's working, right?
Well,
I don't know.
well, that's it's in the books. Okay,
Right.
that's what we have seen in the books. That's what some researchers have said. Okay, and that's what many of us follow. We pick it up and we run with it. But in Nigeria, I don't think any study has been done on that. I've not come across any study done on that with sexual activity and developing prostate cancer. But this is what we have found from some researchers, and that's what some persons are preaching. So maybe if it's a good thing, I think men should engage in it more often if it truly lowers the risk.
All right, now let's move over to signs and, some of the symptoms a lot of young persons should be able to look forward to so as not to be caught off guard and unaware about, prostate cancer.
Yeah. Yeah, so for men in their 40s,
Okay.
in fact, recently they have included men in their 30s, their late 30s should begin to watch out for signs of prostate cancer.
But I actually thought it has more to do with the older men compared to younger,
Yes.
folks.
Yes. Well, the peak age or the average age that we have found prostate cancer in men in their 60s,
Okay.
66 years actually. But it doesn't mean that a man who is 50-year-old cannot come down with prostate cancer. We have seen men in their 50s, early 50s coming down with prostate cancers. Yes, but the peak age or the most common age where people present with prostate cancer is in their 60s, age 66 being quite common in many studies. Now, when an individual sees himself urinating more frequently, and the person goes to the bathroom to use the toilet, and the person is unable to urinate as immediately, as he's getting to the bathroom, okay? Or the person urinates, then feels that he has not voided out all the urine and has cause to come back to the bathroom again. Or we start seeing signs such as weight loss, low back pain, and in fact, sometimes when the cancer has become very severe, people can come down with cough. That's if it's pressed to the lungs and like that.
What
yes.
kind of cough? Because on a normal day, Nigerians cough.
Yeah, Nigerians cough.
So how do you know which is cancerous?
Yes, that's why when the individual comes to the hospital
Right.
and is properly evaluated, we'll pick all of those things. So when an individual starts to see all of these signs, frequency in urination, or there's something just so abnormal about urination, you go to the bathroom and you discover that the urine doesn't travel as far as it used to travel, or the person is urinating and it's start and stop. It's start and stop. The person goes to the toilet, comes back immediately, is going back to the toilet again. So the person should begin to suspect that. What could this be? What could this be? Then also, let me point out here, because it's very common in this environment, somebody having frequency in urination, and the person begins to think, okay, it's just frequency in urination. Maybe it's diabetes.
That's the weather.
Yes, or maybe it's the weather. Then the person just goes to, buy drugs from across the road and starts to use. So I don't advise that. So people should go to the hospital whenever they notice any abnormalities and not just go to take drugs across the street, because it might be prostate cancer, but the person is thinking, oh, maybe it's infection.
Okay, so now let's talk about the duration, because just as you said, frequent urination could mean anything, right? So for how long should someone observe that particular, some of the symptoms that you've mentioned? You said when you do not immediately urinate, because I know some persons might actually have that sort of experience. So how can one differentiate between both of them? How long does that person have to wait, before going to the hospital for checkups? 2 weeks, a day?
I'm not going to give you any duration.
Okay.
Because for God's sake, is an abnormality. It should not be.
Oh.
You understand? So when you go to the hospital, we should be the ones to tell you that this thing you're presenting with, this is the problem, or this is prostate cancer, or is an infection, or is something. Because the more you wait, the more severe it becomes. So I will not advise anybody to wait, say you are waiting for, let's be looking at it 5 days, if this thing does not, no, there's no point. The moment you discover that this is not normal, then go to the hospital and let's give you a proper diagnosis.
Now, speaking about, because you said the more severe it gets, it's a severe kind of cancer. Is it life-threatening?
Yes. Prostate cancer is the most common cancer in men, and it amongst the cancer that kills, it is the second most common. That's after lung cancer. So it's, as it gets severe, the person is getting closer to dying if nothing is done about it. So it's actually a very serious condition.
Wow.
Yeah.
Well, if you're just joining us, you're on to Healthy Living right here on Independent Television. And our major attention really this afternoon has been prostate cancer awareness, stigmas and misconceptions regarding it. And I still have my doctor here with me in the studio, Dr. Oreoluwa Joshua, doing justice to the conversation. As we tend to move over to some of those misconceptions out there, because just as you said, it's a lot, and it's one of those, commonest, if there's a word like that. So what are some of those misconceptions that should be corrected going forward in the society?
Okay, so we already mentioned some of them.
Right.
About the issue of frequency of sexual activity. It's still a misconception, not totally proven yet. Then the symptoms can easily be mistaken for another disease condition.
Right.
So when people start seeing signs and symptoms of prostate, they should not completely rule it out. That's another. Then again, some people may be of the opinion that, well, it is not in my family, so I cannot have it. And what we even advise these days is that men in their 50s should go for regular screening. Therefore, those who have a family history of it, when they're in their 40s, they should start going for screening for the prostate cancer.
When you're in your 40s?
Yes, if there's a family history, maybe an individual's dad had prostate cancer, or an uncle or a close relative had prostate cancer, then when that individual is in his 40s, should start going for screening to check if he too has the prostate cancer. Then people who don't have it in their family history can start doing that from their 50s. Yes, so, and the misconception that I'm trying to deal with here is that people should not completely rule out the fact that, well, it didn't happen in my family, so I can never have it. Then some people will be of the opinion that, well, these people that engage in risky behaviors, maybe risky sexual behaviors, that can come down with prostate cancer. No, it can happen in anybody. So these are about the common misconceptions we have in our society. And I hope that I've done justice to it.
Is it curable, prostate cancer? Can it be cured completely? Because what actually happens next after a person, has been diagnosed of prostate cancer?
Well, in its early stages, it can be dealt with, it can be cured, just like other cancers. But when it starts to become severe in the advanced stages, then there is little that could be done to salvage the cancer. But in the early stages, for example, we mentioned earlier that when people are in their 40s, in their 50s, they should start going for screening. So once they start going for screening and they begin to detect maybe the chemical that the cancer cells produce, they detect it in small amounts. They'll say, oh, this individual has a risk for developing prostate cancer, let's do something about it. So they do, depending on whatever stage it is, if it's going to be medication or a surgical procedure, they do it and take it out, and the individual is fine. But when it's in its advanced stages, maybe when it has spread to the bladder or to the spine at the back or to the lungs, like I mentioned earlier, then there is just very little that can be done. So in its early stages, it's curable.
Pretty much, that's really quite scary when you say there's very little that can be done regarding it. So at this point, I feel like someone watching right now would say, okay, so what can I do to prevent myself from actually falling, you know, into this kind of cancerous situation?
Okay, great. So men in your 40s, please start going for screening.
So once you hit 40, you start going for screening already?
Start going for screening already,
okay.
Especially
is there a name? What kind of screening? Is it prostate cancer
so
screening?
when you go to the hospital, when you go to the hospital, tell them you want to do a prostate cancer screening. So they will take your blood, right? So we call it PSA, prostate specific antigen.
All right.
Okay, so it's like a chemical that is produced by the cancer cells, all right? So they take the blood and they check. So if there is maybe any atom or anything like prostate cancer, it picks it, it detects it and tells you, oh, this is the level, all right? Then the individual will now go for a scan to see how large the prostate is, okay? So if the individual goes and do all the blood tests and nothing's happening, say, okay, well and good, you know, you're fine. Just what we now say is eat healthily, you know, cut down on drinking and smoking, do some exercise. If you're overweight, shed some weight, you know, then eat healthily, rest well as well. So those are the things that we do to prevent such. Then there's one very bad behavior that we Nigerians have. You tell somebody that this individual has a particular disease condition and the person goes, well, it's not true, you know. But such individuals are supposed to, you know, relate with the doctors and ask what can possibly be done and not just completely ignore, you know, that situation.
Right.
Yes.
Okay, so it's pretty much, I feel like it's a lot of things to talk about regarding prostate cancer because it's one of the commonest in all. But I really must thank you, Dr. Oreoluwa Joshua, Assistant Secretary General, Association of Resident Doctors under Edo State Government Employment, for creating our time to come here today. Thank you so much. Hopefully we have another time to do all of this.
Yeah.
Absolutely. So pretty much you heard it loud and clear. Stay off smoking, stay off drinking, and just ensure that you live a certain, you know, amount of good life, I would say. I am Anu Oluwapo Stevens. I'll catch you on the next episode. Stay healthy.